Welcome to the Power Curve. I'm Holly Scott. Our podcast allows me to chat with accomplished industry executives regarding decisions they've made along their career path with the idea to empower you, our listeners, as you navigate your own career trajectory. Today, I have in studio with me Tom Calef, the Chief Technology Officer at Active Surgical in Boston, Massachusetts. Tom and I have known each other for many years since he was a young engineer, and I'm pleased to have him here today with us.
Thanks for having me, Holly. It's always great to be involved with these types of things. I really appreciate the opportunity.
Oh, it's definitely our pleasure. Tom, I invited you because you have such a unique career and a unique history. And as our goal that we've discussed prior to this conversation, I like to offer individuals that are in our audience nuggets and advice along the way, things that you've experienced that may help them as they drive their own career over their lifetime. So maybe we could start. You have a very interesting foundation: computer science, computer engineering, mechanical engineering, started in automation. Tell me a little bit about what brought you to that education and what decisions went into those choices.
Yeah, sure. So I think from honestly the earliest times, I've always been a technology guy, a computer guy. Um, some early influences from my parents. My mother was like she was an engineer at IBM back in the 70s and early 80s. Uh, but I had always kind of taken to just how technology came together, how computers came together, and I was just awestruck by the things that it could empower, even at the earliest age, how it could really tie people together. So it just kind of took, and I realized that I wanted to make them. I wanted to really understand how they ticked, and figure out, if I wanted to make my own, if I wanted to work with the manufacturers or integrate them into some sort of a robotic thing, how to do that. So that's where the computer engineering piece came.
Mm-hmm.
The mechanical engineering piece came was probably a little more practical, because what I realized was there's a lot to be done in terms of robotics after the brain was made, right? How do you take the brain and turn it into actuation?
Hmm.
How do you actually make it interface with the real world?
Mm-hmm.
And I felt like I needed some formal training there, thermodynamics, advanced math, quantum mechanics, that kind of thing. How do we actually start turning vibrations into signals? And I also thought it was a really cool way to see the parallels between all the engineering disciplines. So the parallels between electronics and mechanics.
Mm-hmm.
You have resistors and capacitors, and you have dampers and springs, right?
Mm-hmm.
It's all the same equations. It's just how you apply them. So
Mm-hmm.
I love looking for those parallels in nature,
Mm-hmm.
and then and in technology. So just a cool way to go about it, I guess.
No, that's very interesting. I didn't know your mom worked for IBM. So you grew up with the computers that were as big as the room, right?
Yeah.
Initially.
Yeah. Yeah.
That's fascinating. Wow. Yeah. So you learned about the brain, and then you wanted to learn about the the exoskeleton system that could actually make
Right.
these things move and happen. How did you get into automation? I think your first early days were in automation, right? Did you have a mentor guide you at that point, or was it academic, or did you fall into it? I'm curious.
Yeah, sure. So, well, I've been in robotics since I was 12, right? So that's the type of thing that I had really early mentors. I think a lot of people have kind of heard about the first robotics program. Back when I started, I started with that back in 1996. Still a mentor today on it, and something that I hold close to my heart. Uh, so I had kind of been around that type of technology, seeing how things can move and locomote. Uh, so again, I had that, the earliest stages, but also, you know, my father, so my mom was, the IBM physicist. My dad was a heavy diesel mechanic. So it was always this interesting kind of joining of technology and math, and then the practical aspect. So I had always really enjoyed the mechanics of making things move. Um, one of the early mentors from my time in as a student on first, kind of opened up his network to me after I graduated from UMass, and said, hey, there's a really cool little startup down here that's doing some custom automation and robotics. Do you want to come build robots? It's like, you turn that down, right?
Of
So
course.
yeah, so it was pretty great, and at that point it was honestly, it was everything I wished it could be. It was taking software and making big things move with it. Everything from 500 horsepower electric motors that cooled nuclear submarines. Like that was my first job. was a cooling system of a nuclear sub, but to big rotary machines that it was just impressive stuff that humans could never do because of the environment or the workload or whatever. So I was really fortunate to have that opportunity, and then of course take it and pour your heart and soul into it.
Yeah, well, you had the passion, you had the foundation, and came from both parents. It sounds like you got the best of both worlds there. And then also the timing, right? We were in an era, you and I grew up in an era where that type of blend was an absolute magical formula for where technology has gone, right? And that,
Yeah.
kind of brings me into your first startup, right? And that was Med Robotics, correct? How did you get that opportunity?
Yeah, I'd say Med Robotics was my first med tech startup.
Mm-hmm.
Yeah, I had the other two companies were very small. I would probably consider those as small companies as opposed to startups. And
Mm-hmm.
and Med Robotics is that true kind of funded startup, right?
Mm-hmm.
I got that opportunity through, interestingly enough, it's the same individual. It was 10 years later. It was more of an inspiration, I would say, than having the opportunity to lay out in front of me. Where I had heard of this company, at the time it was Cardio Robotics, and said they're doing some of these trials in this building, and I said, oh wow, well, what are they doing? He's like, I don't know, some sort of a surgical robot or something. Like, I need to find out more about that, right? So I sent an email to info@cardiorobotics.com and just said, hey, looking for to kind of up my game and get into medical devices, and I have some background in robotics, systems level thinking, that type of thing. And they got back to me the next day, and then we just started talking through there and ended up in a career at Med Robotics. So it was, again, a fortunate time,
Mm-hmm.
to start Med Robotics when that was kind of just at one of its kind of first inflection points of taking off.
Mm-hmm.
And it was a lot of fun to come in and write code
Mm-hmm.
and make that system move.
Yeah, no, that was a phenomenal step for you,
Yeah.
and interesting to hear. There's no arguing that you made each step based on passion for the technology and the challenge. Each
Yeah.
step early in your career, that was clear. Everything else basically surrounded that, people you knew, mission of the organization. And that Med Robotics is an interesting one because you were there for a long time, and as one of the early med tech robotic plays, that has its pluses and minuses, right?
Right.
And you rode that. 6 years in a startup is a long time. It's a lifetime, really. That's
Yeah.
that's
Right.
much longer than many people experience. As you were growing within the organization. Also know you started a family. Were there times where you were like, oh man, passion, career, livelihood, passion, career, I have to weigh these things out? Were there times where you felt torn that they couldn't be the same thing? Do you, what
Yeah, all the time. Like, and that's the thing with I think startups and kind of emerging companies is you're constantly at this battle for balance,
mm-hmm,
and work life balance is, in my view, isn't a thing. You,
mm-hmm,
you you do have to find out how to work them both,
mm-hmm,
and it becomes a lot easier when you're working on your passion,
mm-hmm,
right? And if you don't have that passion, there's going to be a lot of times that a small company or a startup company really stresses you out,
mm-hmm,
and it's at those points where you would, if weren't highly passionate about it, you say, okay, well, I'm going to go do something a little bit easier, right? Um, but knowing the mission of med robotics, understanding, that there's, hundreds of thousands of people out there every year that, were getting disfiguring surgeries because they couldn't have, operations on very hard to reach areas of the anatomy, was something that, hit home. I said, this is really important. And I get to work with great people, and I get to work on robotics, and I get to stay at the forefront of medtech. But yeah, I mean, the number of times that it was, hey, I can't work, 80 hours a week every week. I have preschool we got to set up, and all of these things. And yeah, that I think that it's consistent, constant. It's what you have to expect when you get into a company like that.
Yeah, it's interesting. You're so right, and so many of my colleagues and people in industry chat about the fact that there really is no work and life balance. It's all one life, right? And when I hear you talk about the commitment that you had to the mission of med robotics that got you through the tougher times, it really does sound like a commitment to, say, a marriage or any other really long-term, worthwhile endeavor. If it's something that you believe above anything else is worthwhile, it's worth putting in the work, right?
Right.
Yeah.
I mean, for the most part, you spend more time working than you do with your loved ones
true.
at home, right?
That's
I mean,
true.
so it's
true.
exactly that.
Yeah.
And to that, I was really fortunate to be in the first clinical studies over in Europe. In 2014, I spent pretty much all summer over in Germany, and working between 4 clinical sites, seeing most of the procedures happen. And that's what really locks it in, and I really wish everybody had the opportunity to see their technology help somebody like that, right? Because when you lock eyes with a patient going into the operating room, it kind of makes you look within yourself and be like, wow, I did my job well, but this person's really good. It's really going to be used on this person here. And from there on out, it sticks with you. It sticks with what it means to use your technology when people are at their most vulnerable. And that just solidifies medical devices in general, right? There's, very few industries that can have the impact that you can have when you design a device that, that will help humans, recover, get better, have, better outcomes and the like.
No, it's so true. You look at this patient and you say, gosh, that could be my mother, my father, my child, my son,
Right.
that brings it home. And it's interesting to hear that commonality between people that have aspired to C-suite, as you have, and a number of individuals I've worked with, where that passion still remains, and that's the vision they have when they wake up in the morning on those bad days and say, I remember that patient. So speaking of those days in that young company, there was a recruiter that tapped you on the shoulder, and that recruiter, who is not named at this point, convinced you to take a look at another opportunity. And it wasn't convincing. It was talking about some of the challenges that you were weathering at the time. You were really weathering some serious storms, and you went through process, and you got an offer, and you accepted the offer, and then you went back to said recruiter a few days later and said, you're not going to believe this, but I can't start. And not only I'll never forget this conversation, because I was said recruiter, if you hadn't figured that out yet. But I think our friendship really solidified at this point, because when you told me what was going on, and I knew what was going on with you, I could only be 200% supportive of your decision. I could only be it. Could you walk us through that? Because, in terms of career development, our audience hears all day, never accept a counteroffer, run. It's the scarlet letter. And granted, I've seen more cases where it doesn't work out than it does. But
Sure.
You being that unicorn, put some context around that, please.
Yeah. So I do remember the time. It was a while ago now, and it was definitely a trying time. And not to say, there's more trying times than good. I mean, there's a lot of really good times, at a lot of these cases, and that's why you do it, right? But at this particular time, you want to look at yourself at different points in your career and say, okay, am I comfortable, or am I still progressing down my vision of career, right? And at that time, I had heard a lot of, you don't understand because you don't have a big company. You don't understand because X, Y, or Z.
Mm-hmm.
And part of that was, I need to go learn from a big company of process and, rigor and all this kind of stuff, because, I'm a small company guy,
Mm-hmm.
right? And, once when I went through it, you get yourself excited about a position, and then I think what really took hold was it becomes real when you get the offer,
Mm-hmm.
right? And it really becomes real, and you say, yeah, I think this is right. I think the pros column is really long. Um, at that point, I think the biggest piece that came around was, am I doing this for the right reasons, right? And is kind of hanging on here in med robotics actually still getting me to my career visions? And do I need to take this jump right now?
Mm-hmm.
Right? Because the gap that I was filling at that point was, do I need to go to a significantly, one of the very largest med device companies in the
Right.
world, um, or can I do that at some other point in my career? And am I losing what has kind of kept me in my career and kind of kept my, has been my, my lighthouse, which is, follow your passion, follow technology,
Mm-hmm.
that, follow the problem,
Mm-hmm.
right? And, when I started looking at that, I was like, I'm in the right spot. Yes, I, had conversations that, helped me advance my career at that point. No doubt about it. Right. That's, when, there's always an economic side to
Of course.
the world,
Sure.
and we all have mortgage payments to make.
Sure.
But at that point, I think the biggest thing was the problem, the technology,
Mm-hmm.
and what I was working on. I knew that I wasn't going to get the opportunity to continue to commercialize, some really impressive technology. But maybe I'd have an opportunity to go to a larger company later,
Mm-hmm.
if that gap still existed and if I still perceived it the same way.
Mm-hmm.
So it was a really interesting time,
Mm-hmm.
and I was very happy to have you on the other end of the phone to kind of talk it through with and understand,
Mm-hmm.
because it was definitely not an easy decision, at the end of the day, but I still think I made the right one.
Well, I think we both agree with that, and the timing. From it was interesting because what I experienced at the time with you and what I hear you and reminding me of that moment was you once again came back to what was authentically you and in your heart, right? And the whole world, and I'll chat about this through blogs, articles, career development often involves opportunity at small companies and big companies. Opportunities can abound from that experience. It can make you more marketable. All of these things. And when you hear that all the time, it's only natural you're going to pay attention to that. And that's what happened. You paid attention to it and you went down the road. But you know what? You came back to what was viscerally right for you was your commitment and passion to the organization. Now, at the same time, there was a renewed appreciation and value on you in the organization. And if those two pieces hadn't happened at the same time, I would have never
Right.
counseled you to stay. But
Yeah.
based on what they did and where your heart was and your head, it made sense. It made sense. And by the way, the counteroffer they put in front of you was something I've never seen since or before. Okay? So that's when you say you're a career serial startup guy, it's okay. That's okay. That's okay. You've done very well with that. So, which is interesting. Which brings us to moving away from med robotics. At some point, you finally made that move, And how did you get introduced to active? This is another interesting story. I found it extremely
Yeah.
interesting.
So I got a phone call one day, and it's, again, it's, startups is these waves, right? And usually a lot of them are really high, and you love it. But sometimes the calls come right at that opportune moment where you're like, I could use a change today,
Yeah,
right?
yeah.
And I got a call, and it was really interesting because uh, a lot of times you dismiss opportunity, right? You
Hmm.
dismiss, hey, they didn't say the right two or three words, they didn't, and this particular one, I could tell that it was a junior recruiter on
Hmm.
the other side, and I was like, I need to help this guy out. I need to, I need to dive in and be like, what you're really looking for. And as we got more into it, I was like, this is actually a really exciting role, because now I'm learning more about the technology that had come up. It was this technology that I'd actually read about, right? I subscribe to science, right? And so I saw this article come out of Dr. Peter Kim, and what they're doing with autonomous surgery. I was like, oh, of course, this is going to happen. It's a matter of time. This
Hmm.
is going to happen. And then 2 months later, I get the phone call. Hey, after really learning about it, would you like to lead the technology portion of this? It's like, well, yeah, of course I would, right?
Wow.
I'm going to jump at that opportunity.
Sure.
And there were logistics of where is it going to be, and all that kind of thing. But we work those out. Those a lot of times are conversations to be had, and
Hmm.
negotiations. And I was really proud uh, that I was able to negotiate that we could put it in Boston, right? And as opposed to a couple of the other places in the states,
Hmm.
and that's really what made it possible, was you know a network that we could have here in Boston to start out from, because I know some of the shops and testing
Hmm.
labs, and an engineering pool, and all that kind of thing. And uh, it just made sense at that point, where if we can if we can keep it in Boston, I think that this thing actually, that we can change the world and change the face of surgery. Uh, and so yeah, that's when I took that opportunity.
Hmm. Another unicorn moment. So the company wanted to recruit him and couldn't get him to come to said location. And all of a sudden, oh, Tom, if you'll take the job, we'll make it right in your backyard. Okay, all right.
Yeah,
So
yeah.
it's a little harder to
That
walk away from at that point.
exactly. Yeah,
Oh
and
wow.
quite honestly, these are some of the things. This is what's great about startups, right? Is when you actually talk through some of the issues, you find out that a lot of them are movable. They're not these not these mountains.
Exactly.
They say, well, we're reasonable people, and we all believe in this, so
Hmm.
let's do what it takes to make it happen.
That's right.
And I think you run across these decision points, and times in a
Hmm.
company where more often than not that's the case. That's the conversation to be had, as opposed to saying this is the way it has to be done. It's what can we do to work together to get it done.
Yeah, I think it's easier to clarify the vision and
Yeah.
for that smaller um, party of high performance athletes that are dedicated to that task to
Mm-hmm.
create the right plan, right? And
Right.
if that involves moving, it doesn't matter because, well, frankly, it's not much to move yet. We're
Right.
talking about ideas and IP and where can we build it. So, yeah, that move to Boston was an incredible opportunity for the company and for you. And
Yeah.
now, do you want to share a little bit about what excites you about where Active is headed?
Yeah, I think where Active is headed is incredible, and I think it also just kind of aligns where I think a number of folks in medtech are kind of aiming, which is truly data driven intelligence. And it's getting to the point where systems are not only intelligent but aware,
Mm-hmm.
right? They're aware of the steps that were 3 or 4 leading up to it, and what's going to happen. So um, what how I see kind of Active playing a part in that is as this intelligence engine that enables all systems to become more intelligent, right? So we've we've built this out. We've spent a lot of time and a lot of effort and invested a lot of resources into making sure that we can make this truly agnostic system that brings along medtech into uh, this realm that encompasses AI and machine learning to truly change patient outcomes. There's you look around now in medtech, there's just not a lot of AI going on yet.
Hmm.
Outside of the industry, it's been going on for years, right? 15, 20 years. And you say, wow, are we that slow, or is there something that's just really hard?
Hmm.
And the data piece of it is just really hard to source good clean data, and then that flywheel will start to turn,
Hmm.
but it's difficult to get moving. And I think that we've come up with a really novel way to get it moving by creating some sensors that can sense some physiologic, and tie that to the anatomic, uh, to really provide a high quality training set for not only our data scientists to work with and develop on, but everybody's. So I do truly see that patients will be you know positively affected
Hmm.
by the use of data. I mean, we saw it actually through Apple's latest release, right? They're able to detect O2 sat.
Hmm.
Fitbit just released that they can detect AFib over 97% of the time. And all of these are insights that are data driven and delivered with data. And
Hmm.
it's just what we've seen through cell phones and driverless cars. We're just going to see the same uh, kind of inflection points in med tech, and
Hmm.
it's truly exciting to be part of it, right? And to kind of be on the what we perceive as the ground floor of a turning point in med tech to make things just more aware and intelligent.
Clearly, no. Active is without question a company to watch. Really cutting edge technology when it comes to information for the surgeon, better clinical outcomes. There's a lot of excitement from our organization and from the marketplace. So, if you think back on your experience, so in automation, in the other smaller companies, and then in startups, and now you're leading a technology effort for a prominent young organization. What are some, were there any experiences, inflection points that you think best prepared you for the C suite in a startup?
Yeah, I think med robotics as a whole, when you go through a life cycle of a company, when you join it from infancy
Hmm.
all the way up through getting something commercialized, that's something that is really important to be able to analytically think about, right? So not only do you experience it, but you truly think about what the levers are and what the moving pieces are throughout that whole journey. And I was lucky enough to work with a number of folks that brought me along with the journey, right?
Hmm.
So I could have easily just kind of stayed within R&D and just developed things and been tech support and that kind of thing, right?
Hmm.
Uh, but I had some great mentors. Our VP of regulatory, Jack Bonacera, was amazing, and he said, "Hey, come on down and meet the FDA. Like, let me teach you what this process looks like and why." And then I couldn't get enough of that. I was like, this is amazing. This is really our customer, right? Our first customer is FDA in terms of our the quality and rigor and everything that we do. But then also to have a number of our commercial staff, kind of reach out and say, hey, come along. Rich Walsh and Randy Gaines, they just said, come on over to Europe and work with us. Show it, so you can see what it's like on the other side, and talk to the patients, talk to the docs, and see what true usability is, right? Because we think usability in the lab is one thing, but when it's actually out in an environment that's a patient on the table, that's the usability of a whole different realm. And that these experiences are just super important to be able to be part of, and then again just think about, because all of those connected pieces are what makes a company tick.
Hmm.
So when you can say at the formative stages of a new company, well, you know you can kind of visualize the field and say, well, these are the pieces that we need to have in play, and here's the glue in between it. I think you can start from a much more strategic stance. So I would say, just med robotics as a whole, and being able to kind of work with, the number of folks there that I did, really just set me up to envision what a life cycle looks like.
Mm-hmm.
And then I've had mentors, not only from a young age, but I still continue to have mentors. I think it's super important. Yourself, right, and Joe, and some of the others that are in the industry of, other CTOs, CEOs of similar and larger companies. The folks at Mass Medic, you go into, you start speaking to, all these people that have the same passion and drive, different experiences. These are all the things that as soon as you kind of wrap all of that together, you say, okay, now we can be a little more strategic. And that's, in my mind, that's what the C-suite's about, right? It's about being strategic.
Yeah, no, you got excellent cross training from that experience, and as you think about those who might be younger in their career, it sounds like whether it's a small company or even a larger organization, the more broad they can expose themselves to other functional areas, the more they understand about the business. Would that be your suggestion to some young in career if they aspire?
100%.
Okay.
100%. As the ability to integrate, not only, if you're on the technology side, integration is always the beast, right? You can have all these cool little, tricks and toys, but as soon as you integrate, that's where things get tough. But if you kind of abstract at one level and say, okay, from a business side, what does it look to integrate? What does it look to integrate a product development and marketing push, right? To make sure that there's actually a customer there on the other side,
right,
and be able to have empathy for a marketing professional to say, let me help you. Let me create some demonstrations that you can actually put in people's hands. And what does it mean to actually work with, CFOs and finance to say, well, let me figure out a good way to tie together our development cycles and technology releases into a way that makes a business plan tick. And yeah, I think having access and just visibility into all of that, if there's any opportunity to do it, take it, right? Even, if it's an extra, 10, 20 hours a week, you won't even realize that you did that 10 or 20 hours, next year, but it'll be so super important to have that just kind of in your toolbox and, just in the back of your mind when you're making a decision.
Yeah, keep any of my younger in career listeners, especially those who have asked about, should I go get an MBA? Should I go get a master's degree? Weigh that against the time you could be spending volunteering, literally, shadow people in other functional areas of an organization. If you aspire to leading an organization overall, getting that cross training becomes much more important if I have two individuals stacked side by side than that degree in many circumstances. And I'm not taking away from the education. I'm saying just make sure if there's certain hours in the day, that experience that you get from a small company or from understanding the components of integration, engagement, commercial efforts, all of that can make the difference between success and failure overall.
Yeah, it really can. And I think, there's a place for formal training. I highly regard, formal training and in degrees, but, I think being able to get in there, show your grit, understand it, there's a lot to be said for that. And quite honestly, when I interview, young up and coming people, it's all about, tell me about your passion and demonstrate your grit, right? Because that's what we need.
That's
right. As a startup company, and if you have that, the rest of it will come.
Yeah, no, that's fantastic advice, and congratulations on the career thus far. I'm thrilled to be on this journey with you.
Thanks for being part of it.
Absolutely. Looking forward to the next 60, 70 years of it, okay? Because we're both still super young. Well, Tom, thanks again for spending time today. I think that this has been incredibly helpful, especially for those who are on perhaps more of a technical path, and they love the passion and love the younger, more emerging technologies that are available and want to work on cool stuff. Well, you've made a career of that and have done extremely well. So Grateful for our time together and grateful for our friendship.
Thanks a lot. Thanks, Holly.
Thanks, Tom. Thanks for being with us on the Power Curve. See you next time.